came in beyond miserable. I am not joking when I told you I cried multiple times last night. Just laying on the couch with my arm like this.
Yeah.
Just.
Oh, no.
My poor boyfriend, he's like, is there anything I can do? I'm like, don't fucking touch me. Don't let the dog touch me. Don't let the air blow on me the wrong way. He's like,
welcome to another deep surface healing massage video. Today we have something that's kind of similar to a previous video that we posted. Nerve entrapment, nerve compression in and around the thoracic outlet, cervical thoracic junction. The reason we're posting this video is because it is one of those really, really awesome one and done situations where we have the client come in, they're having some severe nerve, radicular symptoms, numbing pain, tingling, radiating pain. And you're going to see that in the assessment here, but we do a really, really great job of opening the right muscles that need to be opened and also calming down and decompressing the muscles that are swelling and creating the enclosed space in and around the nerve root. So you're going to see the assessment here, and then I'm going to kind of just quickly narrate us through our flow pattern here for how we're going to relieve these symptoms, and you're going to see some pretty great result in the reduction of inflammation towards the end. So enjoy.
started hurting yesterday afternoon.
Okay.
And now it is expanded up to almost the base of my neck, the base of my skull, all the way down to about mid-arm, and then wraps around to behind my shoulder blade and then back up to the neck.
Okay. So this is numbing, tingling, radiating?
Numbing, tingling, radiating, and the occasional just lightning bolt of pain.
Okay. Yeah. The zings. Gotcha.
Yeah.
So how long have we been dealing with this?
If I hold it real nice and straight like this, it's the only way I cannot cry.
Yeah, just like how you're holding it here? Okay.
Like, try not to tense any muscle on that side of my body.
What happens when we let this extend?
Lots and lots of hurt.
Okay. How about we come back to the safe zone?
Actually, my fingers go numb when they're all the way down.
Okay. So now just descend and stop when you start feeling symptoms.
Okay. Like about there, I start feeling it up in here.
So now as you try to open this and you start to feel symptoms, between 1 and 10?
About here, I'm going to give it like a 6.5 to a 7.
Yeah. And as you try to...
Oh, we're going up into like an 8 about there. Yeah.
Okay.
Straight down, my fingers are numb.
Which fingers?
These guys.
Full Monty?
No, just these guys in the middle here.
Yeah?
The other ones seem about fine.
No pinky or thumb? Wow. That's crazy because the pinky or thumb would have just immediately told me which nerve this was.
Near.
Unfortunate.
It's like when you find something wrong with someone's eyes, it's always a sixth, it's a sixth nerve pulse.
So we have fingers 2, 3, and 4. Sure. All right. Well, I mean, this now is anybody's ballpark. Could be medial, could be radial.
Yeah.
Could be ulnar. Okay. So
we're gonna make you work.
Yeah. Okay. So let's see what happens when we do some basic shoulder elevation here.
It doesn't want to. I feel like I'm lifting myself up to try and raise it.
Is there any pain here?
Yeah, it's mostly like right down in this area. A lot right there in that bend.
Okay. So we're gonna try and slowly, and we'll just come about here to where you're about a 6, 7. Yeah. And now we're just going to raise this shoulder up by itself.
Yeah, I don't like that.
Yeah. Increase? Okay. And then let's come down. Decrease as we come down?
That much pressure, probably a little bit more, but slightly higher. It was about the same. Okay,
so I'm going to bring you back sort of neutral, and then we'll have you try and laterally flex here. And let me know if we get an increase.
Not yet.
Okay.
It's starting to, I can feel it starting to pull, but it's not causing any pain.
Okay. All right. And now if we stay like this, and then we start to come back, let me know when it increases.
Yeah, right about there.
Okay. All right. Let's come back. And then from here, we're going to lean this way. Let me know if it turns up.
Yeah, that's up.
Yeah? Okay. All right.
Almost immediately, yeah.
Okay. So we got plenty of like kinetic movements here that trigger it. That way we can test just how much progress we make when we're
Right.
done here. Okay, so now we're going to come back to safe. Yeah? All right, now tell me about this side.
This side feels totally fine.
Okay.
Well, it's usual self.
Yeah.
I mean, it's tight, but not severe pain.
Okay, let's figure out how we got here. So what are we doing with this throughout the day?
Computer most of the time, sticking
Yeah.
people with needles.
What does
So
it
a
look
lot
like
of-
when you stick someone with needles?
You get low, and then it's like this. A lot of repetitive, like you're holding with one hand.
Yeah, I
and
want to see where
sticking
tension
with
is
the
in
other.
this one.
Yeah, right about like up in here.
Yeah? You hold this position?
Mm-hmm.
How long do you hold this position?
For the stick itself, maybe 4 or 5 minutes.
Yeah? Are you leaning on it? Is it holding your weight?
Yeah, it's putting a lot of pressure on the patient and
Okay.
myself.
So we have time under tension with
Yeah,
the flexed hand.
It comes up.
What's the neck doing when you're doing this?
Trying to focus on the patient, so I'm twisted. Yeah.
Okay. So we're twisted
And then
this way?
we do a lot of computer work where my body is facing the patient.
Yeah.
My arms are this way on my keyboard,
Okay.
and then moving the instrument with the other one. So a lot of
Okay. So we're back
stretching
here, internal rotation here. Okay. So,
I do a lot of this number.
okay. So typically we want to kind of treat this like it's thoracic outlet first and try to open up anterior chain here. Okay. So here, back to our safe zone. Chin up. Further than that. Can you get any further than that without any pain?
I can get to about there without pain.
You can get to about here. Let me tell you something. That chin should be able to
pretty
go a little higher than that.
I mean, it can. It just don't feel very
I see where we
good.
start compensating to, where the spine
Yeah.
starts coming into
I
extension.
start
Okay.
to leak.
Sure. What about chin all the way down? Anything?
Yeah.
Here?
I mean, that's always
Here?
been a problem.
Here?
It's always like right here.
Right in here?
Yeah.
Okay. But it doesn't send any signals down, anything like that. Okay.
No,
And then
I
let's try
mostly
just
do that
turning
nonsense.
left and right.
Yeah. This normally isn't that bad
Yeah?
since the shoulder.
Well, let's stop you from cheating here.
That's good.
Yeah, let's try turning again.
Yeah, to about there.
That's it? That's just
It turns
barely
into-
45.
It turns into like a rock right
Yeah,
there.
and we start getting some, okay. And now let's try the other way.
So it's fine.
Okay, well,
Okay.
it doesn't hurt, but our range is kind of poor.
in relative to the way it normally feels.
Okay, so let's have it just here and just try to be kind of neutral here. You don't really have to do it with this arm, but what I'm looking for is just how shifted you are to the side here. We can see that you're not, in the center. Yeah, we can see how we kind of have kind of this going on. Okay, yeah, if I were to mimic you, here, this, and this. There we go.
That makes sense.
Now we're in a mirror here. Yeah.
Because
so-
I've had surgery on mostly my right hand side, so I feel like I kind
Mm-hmm.
of I lean on that more because the left hand hasn't been doctored yet.
Okay.
That's my theory though.
Okay. And so the last thing I want to know is just how much time it takes when we come at to rest here.
To about there.
Yeah.
My fingers start going numb about here.
Yeah.
Actually, all four are gone right here.
Ooh.
But when we come all the way down,
Mhm.
I start to get a little. These guys start to free up.
Okay.
Yeah, those two start to free up here, but up here they all disappear.
Okay. So now let's start working through kinetic.
Okay.
We're just going to chase the nerve root.
Mhm.
Pain in here at all?
It's real tender.
Yeah. We keep ourselves in kind of this position. So I'm going to start looking at biceps, start looking at
Yeah, that one's not too bad.
brachioradialis here.
Up a little higher is where it's getting bad, yeah.
Ooh-wee. Well, we're asking this delt to take over quite a bit in order to keep us like
Yeah, it doesn't want
up
to
in
do
this
that, does
form.
it?
Yeah, and like anterior delt is also helping us to sustain ourselves
Right.
with our weight
Yeah.
here, and then I'm expecting
Right up in
it,
there.
I'm expecting it to be
Yep.
not so nice here.
Oh, I even yoga bombed myself last night.
Ooh.
I was rubbing the shit out of some of these knots.
Okay, so you mentioned having trouble sleeping. So, what position do you sleep in?
All over the place.
Okay, so
until I can find something that's comfortable.
We're uncomfortable all night. Yeah, we're uncomfortable.
With the RA and the fibro, it's like, all right, which part of me is hurting the least?
Yeah.
We're going to sleep on that side.
Okay. Okay. We've got a myriad of movements that we can test afterwards, but we know that we're working with an forward anterior chain that's kind of closed in here, pulling from here. We've got tension and strain and some swelling. Yeah, and any one of these areas, or maybe multiple of them, are responsible for putting compression on this, on the nerve root, right?
Makes sense.
All right, so we're just going to attack that whole thoracic outlet.
Get it.
And see, and see about knocking this out. All right. Okay.
Let's do this thing. Yeah, that's one spot I never understood how it could actually get sore. Like, what does it actually do?
This.
Oh.
Yeah. It's your bench press muscle.
Oh.
Well, one of them.
Since I don't do that.
Well, you do hold it in tension, though.
That's true.
While you're working on the computer, while you're doing your, keeping the body stable, while you're doing this, while you're doing the stabbing. So, okay. So we're getting started here. Anytime I see someone is presenting symptoms that look like thoracic outlet, any kind of nerve compression happening in the cervical thoracic junction, I want to start right away just kind of attacking that scalenes, SCM, and subclavius, pec minor, anterior delt in some cases. But we want to just kind of start with our superficial pressure, just slowly build into deep work in order to get this chain to open up and take its influence off of the posterior chain. We're still getting a signal down to the pinky from here?
It's not numb anymore.
Okay, good.
A little tingly, but not bad.
Good.
That's crazy. It felt like it went from a golf ball down to, well, half a golf ball.
Yeah, I mean, initially we're trying to soften it up, and we're driving a lot of the swelling that's just kind of packed in there. Okay, so we're starting to move away from the anterior chain here and start coming more lateral, more posterior. We start to move towards like levator scap, really good in here, and also the splenius capitis group. We're trying to get the pressure to reduce in this area, the swelling to come down. Often this is kind of the sweet spot for where the nerve entrapment or nerve compression is happening. We're pretty close to where the nerve root is, in between like C4, C5, C6, kind of anywhere in that ballpark. The body's natural response to tension is to swell. That swelling can crowd those areas and just keep kind of pressing on that nerve root, sending those radicular symptoms down into the delts, into the arm, into the forearm, into the hand. Yeah. And as we approach the posterior chain, over-lengthened muscle does not respond well to deep work. So a lot of time, a lot of movement is what we're looking for to try and get the body to not see us as an attacker, but instead to go, oh, okay, we can kind of let our guard down a bit, relieve this swelling, and take some pressure off of that nerve. Okay, so we're starting to move down now. I like to go to the other end of the nerve root, kind of starting up and around the neck where it originates, and then we're going to come down to hand, forearm, and work our way back up to the shoulder girdle and back up into the neck. But that nerve root can be compressed anywhere in the chain. So in our particular session here, anywhere from that nerve root transverse processes in the neck all the way down to the extremity, at the end of the extremity that it controls, which are the arms, hands, shoulders. So we're going to work through forearms really good, and also up through a little bit of bicep, some of that brachioradialis, and try to just make sure we are crossing, we're hitting all the bases where nerve compression can happen just from muscles being tight or swelling and just kind of taking up space where the nerve path is. a lot of times people will come in and have been diagnosed with carpal tunnel syndrome, and they're looking for some, alternative ways to get relief. And we end up arresting and reversing the symptoms just through relieving compression throughout the nerve root and throughout the kinetic chain.
What are we feeling in the triceps?
Not too terrible. Okay, right there's not so nice.
Mm-hmm.
Yeah, that's real not nice. Yeah, that's a real sore spot.
Mm-hmm. The problem is, there's a best way to sit, but there's no best way to sit and work.
Yeah.
Yeah, you'll have to compromise. That's why the strength training and the stretching is so important.
It's true.
Okay, so we've just coming over to the opposite side, working that right side, same hit list. Just really want to make a comparison here, especially since cross-body syndrome is so common. We'll usually have over-lengthened, strained, taut muscle on one side and then hypercontracted muscle on the other side. We know that she's in a position where she's got her head turned to the right sometimes with the forward head motion. So we definitely want to make sure that we aren't just opening up one side of the body. We want to make sure that we address both sides and sort of compare the environment to one another to see who is responsible, who's compensating for who, what other clues can we get to avoid any further dysfunction happening in the body. Okay, so now we get to finish up just calming down the over-lengthened, tense, taut muscles in the upper back, neck, and shoulder. These are the ones who are just kind of suffering the constant influence of that anterior chain being closed. They do not take well to deep work. Over the years, I've found that time, movement, a lot of superficial work is the best way to approach these strained muscles. Once you establish that relationship, that we're not attacking the kinetic chain, that we're just trying to soften it up, trying to push a lot of that swelling, a lot of that built up metabolic lactic acid out of the body, and without the influence of the anterior chain, it really just starts to kind of melt, fall apart. We get a lot of relief in this last step as long as we have set the proper dominoes in place. Here we want to touch on erectors. We want to touch on the capitis group. We want to touch on everything that stems from the shoulder blade, that scapula there, levator scapula. We want to hit those rhomboids. We want to hit those traps. We want to, from there, kind of come up into suboccipitals, really working good at all the intraspinal muscles that are surrounding the neck, under strain, trying like desperately to protect us when we have our forward head motion for hours and hours, putting strain in and around those bony landmarks in the transverse processes of the spine. Okay, so when you came in, you pretty much had to stay like this, right? Let's extend this out. Stop when you start feeling, let me know when you start feeling ridiculous symptoms.
Nah.
Fantastic. Yeah. And so what we did was opened up anterior chain. It's just classic thoracic outlet syndrome. You've got this forward head, you're bringing this in, you're sleeping like this. So all of this anterior chain is just closed and it's influencing you to stay long here. So we worked this to open, then we were able to calm this down without this guy saying no. And I don't know exactly where the nerve entrapment was, so we just worked the whole thing. Yeah.
When in doubt,
just worked
cover all
the
bases.
whole
I mean, honestly, I feel
thing.
like I could do a cartwheel right now.
Fantastic. And we can also come up here. Good.
I mean, heck. I can like fully extend.
Good. Excellent.
Yeah.
All right.
It's crazy.
How about chin down?
Wonderful.
Good. Chin up. Look at that.
I can see the ceiling.
That's what we were missing. You don't have the influence here
of hypercontracted muscle, so we can get up a lot higher now, which is fantastic.
God.
Okay, and then I'm gonna just force you here, and then have you symptoms?
No.
Good. Okay.
I can
and then
feel
I'll have
the
you
stretch,
raise this
but
up.
not in a bad way.
Have you raise this up? Or sorry, raise just the shoulder up. Good. Good.
Yeah.
Not catching hell anyway. Good. 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 Now, of course, we brought your range of motion up, your inflammation down, and we got some decompression and wherever our nerve entrapment was, somewhere stemming from the root here and coming through. But they're going to have to strengthen here. Actually, this whole like upper back, neck, shoulder, posterior chain, and keep this open. And that's how we hold the progress. But other than that, fantastic. Came in miserable, left happy.
Okay, there you have it. This was like a sudden onset nerve radicular symptom pain. Luckily, she was able to get in with me fairly soon, and we were able to knock this out. And a one and done, coming in at very high levels, very, talking about like 6, 7s, 8s when doing certain movements, and we were able to replicate those movements without any of the symptoms. So just really important. Clinical massage can help to reduce your inflammation and increase your range of motion. But if you want this progress to stick, just like with our client here in today's video, you're going to need to strengthen the muscles that are weak. We are challenging our body, 40, 50 hours a week repetitively in these same movements, and we're just chipping away at the body's stamina and its ability to resist the strain that we're putting it in. And that's what will lead to our strain, lead to our arthritic changes, and exacerbate the symptoms that lead to the kind of musculoskeletal dysfunction that I can't help you with. So when you get these type of symptoms coming in, please do not sit on this. Don't let it continue to build. Find a clinical massage therapist. It doesn't have to be me, but make sure that it is someone who understands how and why your symptoms are happening and are using safe, effective methods that are going to give you lasting results. So that's it for today's video. And until the next one comes, I will either see you in that video or I'll see you on the table.